I'm not going to lie to you. If you only ever expect to make a living treating Medicare beneficiaries for a Medicare reimbursement rates, you are probably not going to survive the next 5 to 10 years of inflation and budget cuts. Guys, my name's Tony Maritato. If you don't know me, I'm a physical therapist and private practice owner. Thanks for watching the channel. Moving into the next 5 to 10 years. Today, we're reaching the end of 2023. I'm preparing for 2024. And of course, Medicare once again is reducing reimbursement by 3.4% into the new year. How is somebody supposed to earn a living, pay staff, while providing for their family, running a physical therapy private practice on what Medicare is paying when inflation is going up and reimbursement is going down? I think the main thing we need to understand is that if we keep doing the same thing that's always been done, we are going to get the same results, which is burnt out, unhappy, terrible clinicians. That's really what it comes down to, because nobody can be a great clinician if they're not happy and self-fulfilled. What are our options to use Medicare to do what Medicare does, which is cover the most basic level of patient care? I think what we need to do is look at the practice model. We need to say, okay, what are exactly the things that Medicare covers? Many of us know, if you read the Medicare guidelines, if you read CMS Chapter 15 or any of the other articles published by some of the MACs, we can see clearly that Medicare does not pay for recreational activities. Medicare doesn't pay for a patient to get back to golfing. Medicare doesn't pay for a patient to get back to dancing or gardening or the things that patients genuinely want to get back to. You know, I think we need to take a hard look in the mirror and say, what would happen if we actually asked the patient, what are your goals for therapy? What would the patient say? Well, I did it. I went into my Facebook group. I asked clients who had a total knee replacement, what are your honest goals for therapy and your recovery after your total knee replacement? And guess what? The most popular goals that they mentioned were, it was hiking and traveling and doing things outdoors, recreational activities like golf and tennis and pickleball. Almost nobody said, I want to be able to dress again. I want to be able to feed myself. I want to be able to bathe and groom. None of those things were ever mentioned in any of the goals that patients had reported that they want to achieve with physical therapy. Yet, I bet if I looked at those physical therapy plans of care, I bet I don't see a single goal that was mentioned. I bet the only thing I see is dressing, bathing, grooming, basic ambulation transfers, car transfers, things like that. So the question has to be asked, if we know what patients want and we know what payers are paying for, those two things don't match up. We need somebody to create a solution that's going to come in between that gap to fulfill what the patients want at a rate the patients are willing to pay while not violating our third-party payer contracts.